Good Friday, and this is Tux Taka reporting from UF Health Jacksonville at the Poison Control Center, and I'm reporting for SafeTV904, which is our YouTube channel, in our Safety First CPR and safety training business. And in front of me, I have two ladies who, a couple years ago, we came by the Poison Control Center, and we got introduced to each other. So we're going to have them reintroduce themselves, as well as talk about what's going on with Poison Control Center. It's National Poison Prevention Week, and what they have in store. So, ladies, let's go ahead and introduce yourselves, as well as tell us what's going on.
My name is Debbie Forrest. I'm a registered nurse and a certified specialist in poison information. I'm the education coordinator here at the Poison Center.
And I am Phyllis Bell Davis, Media Relations and Education Associate here at the Florida USVI Poison Information Center, Jacksonville.
Okay, thank you. So go ahead and tell us a little bit about the National Poison Prevention Week and how you're involved in that.
Okay. National Poison Prevention Week is the third week in March of every year. And here at the Poison Center, we bring more awareness to the dangers of poisonings, and we have several activities that are planned for this week. For example, on Monday, March 17th, we will be at the Jacksonville Zoo and Gardens from 10 to 4 p.m. On Wednesday, we will be at the Nemours Children's Clinic, and on Saturday, we will be at the Riverside Arts Market, and we are bringing free educational materials and information to the public.
Okay, excellent. So that's a lot of locations that you'll be able to talk about National Poison Prevention Week. And what came about, the reason for the week itself, and what do you expect to get out of it?
Well, Congress made a proclamation in September of 1961 that they wanted to bring more awareness to the dangers of poisoning and poisoning prevention that can be come about in the home. And so that's when it came to be.
And also during Poison Prevention Week, we are highlighting several of our students from around the service area who have participated in the poster contest. These students are drawing attention to the dangers of poisonings, and we have about 37 students from around our 42 county service area and the U.S. Virgin Islands who will be recognized on next Tuesday on the UF Health Jacksonville campus. We're having an award ceremony where our many sponsors, as you can see from behind me, have donated gifts and prizes to these students that we will recognize on next Tuesday.
Well, as I see behind you, there's certainly a lot of community support for an event such as this, and that's really important for the city of Jacksonville. We have, at least the numbers that I was quoted on, we've got about 1.5 million people in the Jacksonville area, so anything can happen at any time, and that's why a week such as this is so important. I see that you've got some information in front of you to tell us about some of the dangers, and you want to go ahead and highlight those and let us know what those are?
Yeah. Some of the more common poisonings in children under the age of 6, because by far about 50% of our calls involve children under the age of 6. Most of the common ones involve medications, analgesics, household products, household cleaning products, cosmetics, toys, and foreign bodies like the button battery, the disc battery that are in cards and watches and remote controls, and different liniments and lotions.
Yes, and the thing that Debbie talked about, the almost 50% of the children under the age of 6 or our number one victims of poisonings, it's very important that parents and caregivers understand the need to put items up high and out of the reach and sight of a children, you know, your chemical products that you use in your daily household duties, even out in the yards. Since the spring is almost here and people will be out doing yard work, we want to be careful to not put chemicals in a drink bottle a container that has food in it, you're supposed to keep your chemicals in their original containers, because children can mistake those chemicals for food because they are transferred from their original container to a container that kids are familiar with when it comes to eating or drinking.
And we also warn parents to keep their purses out of the reach of kids, because a lot of women keep a lot of different chemicals, such as medications and cosmetics, in their purses, and they're readily accessible. They don't think about it. They leave them out on the countertops and the sofa, easily where children can reach them. We advise them to keep them out of reach of kids.
During that National Poison Prevention Week, it's not something that, obviously it's hidden during this time period, which is next week, but is it important that family members distinguish and help the kids understand what is poison and what they're able to eat or drink? Is that an important education piece that not only you're trying to do throughout the week, but that parents should be able to do that with their kids at all times?
Absolutely. Poison prevention is a year-long event. It's not just during Poison Prevention Week. We just highlight it during that week and try to bring more awareness to it. But absolutely, they need to distinguish between medicines and candy. For example, you don't want to ever call medication candy to a child. That makes them think that it's candy all the time, and then they'll go and get into it when they're not supposed to. And also, just different food products look similar to different chemicals. As an example, if you put a Lysol-type product into a cup and leave it on the counter, to a child it looks like apple juice, and they may come along and drink it by accident. So absolutely, teaching them the difference year-round is absolutely important.
Exactly, and some candies absolutely look like medications, and some medications absolutely look like candy. So we have to make sure that parents understand the lookalikes of these products, and thus again to put them up high out of the reach and sight of a kid. And I can't emphasize enough what Debbie just mentioned about the candy. Come take the medicine, it tastes like candy. All a child heard was candy. You forget to put the medicine back up. The phone rings. You turn your back for whatever reason, and you turn around and the kid has taken almost all of the product because all they heard was candy. So we just want to be careful about that. It's medicine and it's supposed to be good for you, but it's not candy. And do not make that make sure you make that distinguishing effort to not call medicine candy.
And just, as of note, lately in the news, the laundry detergent pods and the dishwasher detergent pods, they look very colorful and very attractive to a child. They look very much like candy, but they can be very, very dangerous to a child. So you absolutely want to keep those up and out of reach of a child.
And we want to emphasize our phone number, 1-800-222-1222. You call us first in a poisoning emergency. We're asking people not to go on the internet to search in a poisoning emergency because, number one, you're wasting your time. Number two, you don't know who put it up on the internet. You don't know the integrity of what is being stated on the internet. We here at the Poison Center have healthcare professionals who answer your phone calls 24 hours a day, 7 days a week, and we have the latest information, and you won't waste your time in calling us. We answer your phone call immediately. If by chance we can't answer your questions over the telephone, which about 83% of the time we can help you on the telephone, we will recommend that you go to an emergency room, and we will call ahead depending on the severity of the event and let them know that you're coming in with whatever symptoms that you're having. So that's why it's best to call us first in a poisoning emergency. Unless the person is not breathing, having a seizure, or won't wake up, obviously you call 911. Otherwise, you can call us here at the Poison Center.
Ladies, I would have to give a confession to you. With our daughter, we have said it tastes good and it tastes like candy. So you have reminded me as a parent that those are some things that we shouldn't say to our kids. It may sound inviting to them, but you're absolutely right. We're giving the false sense of security of what those things may look or taste like, and the kids will definitely gravitate towards something that looks and may taste just like candy. Now, being in the Poison Control Center and all the number of years that you've been here, there's got to be absolute success stories, and we'd love to hear about those. Last time, I don't think we've heard of that. So if you have a success story, each of you, we'd love to hear something.
Well, we have success stories every single day here at the Poison Center. We prevent children from having to go to the emergency room on a regular basis, keeping the parents happy and saving more, healthcare dollars that way as well. And we keep people at home all the time. 83% of the time we are able to treat them at home without having to send them to the emergency room. So those are all success stories. And even the ones that we send to the emergency room, we give recommendations for treatment to the nurses and doctors to help save them as well. So there's success stories every day here.
Yes. And one other thing I want to re-emphasize is the fact that the people who answer your phone calls when you call that 800-222-1222. They are healthcare professionals. They are good at what they do. They are certified specialists in poison information. That means that they are at the top of their game. They've taken a nationwide test to become certified in poison information. So those are the types of people, nurses, pharmacists, toxicologists, medical doctors in some cases can answer your phone calls when you call the Poison Center. So you're in good hands.
And like she said, we're there 24 hours a day. It's a free and confidential service, just like if you go to the doctor's office.
You're just going to the doctor over the telephone, and we don't charge you.
Exactly.
And that alone, folks, is why we present folks such as Miss Debbie and Miss Phyllis to you for SafeTV904, because you get the latest information and you get the correct information. And, we're really proud to go ahead and as a second time, again, come to the Poison Control here at UF Health Jacksonville and be able to, get in front of the audience and let them know about National Poison Prevention Week. So again, I really, really appreciate you and what you do, and it's a passion. I can hear it in your voices. And I'm going to go ahead and turn it over one last time to you if there's anything else you want to go ahead and say to our SafeTV904 audience.
Just want to remind you all that the number to call in case of any poisoning emergency or a bite or sting, anything of that matter as well, anything poisonous or venomous, call 1-800-222-1222.
And we answer all types of questions, as Debbie talked about. I like to say we take care of the 4 Ps: people, pets, plants, and pills. Yes, so if you have a question, no question is crazy. It's best to know the answer than to think about an answer. So call us in your poisoning emergency if you have a question about a new medication that you might have gotten and didn't get a chance to talk to your doctor. If you've rubbed up against a plant and you see something different on your skin, we take care of things like that. So call us first.
Yes.
All right. Again, thank you for all your time sitting with us and talking about everything that has to do with poison and how we take care of people here in the Jacksonville area. So, again, we're signing off here from the Poison Control at UF Health Jacksonville. Go ahead and wave to our audience. Happy Friday.